We look after client group. We also have a public awareness program. So one of our major role is that we do screening for about 15 districts.
15?
Districts, yeah.
15 districts?
Yeah, 15 areas.
And all those 15 areas are covered in a month, or?
We, when you say cover in a month, I'll tell you and then you'll find exactly what we do. Every baby that is born in England here are tested for their hemoglobin type. Now, we, at the moment, things are changing, but at the moment, we cover quite a few of these districts. So we work from here to as far as into North Bedfordshire, which is, we don't have a map here, but into North Bedfordshire. So we do babies that are born in this area, which is not Parkside. We do babies that are born in Harrow, Ealing, Hillingdon, Watford, South Bedfordshire, which is Luton, North Bedfordshire, Hemel Hempstead, Stevenage, Westminster area. What happened when the baby is born at 7 days, the midwife does the heel prick, the blood spot. Someone must have mentioned about those blood spots to you. And they first go to Great Ormond Street. Now, so Great Ormond Street is what we call first line testing. So the blood is sent. There's other areas. There's St. Heliers as well, but we don't really work for St. Heliers, so we work mostly with Great Ormond Street. But other areas such as Southwest London, yeah, they'll be working through St. Heliers department. So our blood goes to Great Ormond Street. When they go to Great Ormond Street, they're tested. If the child is found to have a carrier status or a major hemoglobinopathy, that result is sent to our hospital, which is Central Middlesex Hospital. Every week, usually on a Wednesday, we collect all that results. So we may get maybe 35, 40 results. Yeah? Now then these results come in. Some are carrier status, some maybe one or two will be a major hemoglobinopathy, sickle cell disease, or there may be one or two that we don't actually know what the result is, so they actually need to be retested.
Second screening.
Yeah, so that's right. Central Middlesex is second line screening, and that's who we work for. So when the results get to us, we then share it among us. So Lola looks after a couple of districts, obviously, even though she's the manager, but it's a large area that we're doing, so she still has to take a couple of areas. Then we have Elizabeth that will have her area, Beatrice has her area, and I have my area. So when we dish it out to our whichever area that the specialist nurse was looking after these areas. And we then have to obviously put it into a book and decide when we are going to see those patients. Now you just asked within, if we see them within a month or so.
Yeah.
We will see the sickle babies as soon as possible. Are you hot? You want me to turn that?
No, it's okay.
Yeah? No, it's okay.
It's okay.
Sickle babies, what our protocols say that these children, parents have had to have that result within 6 weeks. That child needs to be booked into a hospital by 8 weeks or seen by a consultant by 8 weeks. So the immediately we get those little babies that require a retest, we will make an appointment to go and see them. And the way we make that appointment is that we write to the parents. So we don't ring them up or turn up on their doorstep. We write. So we make contact with the GP and they have visitor, and we write to that parent, those parents, telling them that we're coming. And that's usually within 2 weeks of that result landing in our office. Okay? Got to be done within that period of time. Yeah? So whatever you're doing, you have got to find space to book that child in to be seen. Once the child is seen, when you go there, what you're going there for is you want to obviously find out what the parents know about sickle cell disease. You want to find out whether or not they have any idea, whether they screened before, did their partner got screened, were they aware that there was a possibility that this child could have sickle cell disease. If they were aware, were they offered prenatal diagnosis? And, obviously, if they're aware and they've got this child, which sickle cell disease, that means obviously is that their choice was not to go for prenatal diagnosis. But what you want to make sure is that this couple had a choice. Yeah, they had a choice whether to go for the screening or not. So ideally, what you want to know is that yes, the mother knows she has sickle cell trait. Yes, father was offered testing. They were counseled. They were offered at appropriate time the opportunity to go for prenatal diagnosis. It's not that we just want to know that they had that choice. Yeah, and they didn't have this baby and not having any idea. Sometimes you will go there, people will know. Others will say, well, my partner wasn't tested. Yeah, and so they didn't know they were at risk. So that's one thing you want to know. Then you want to discuss sickle cell disease, what it is, what they should expect from me as a specialist nurse, what I'm going to do. So I'm going to test this blood, I'm going to come back to see you, I'm going to go through the result with you again. Once I have the result, I'm going to inform your GP, I'm going to inform the health visitor, I'm going to make sure that this baby is commenced on penicillin, and I will book the baby into the local hospital. So whichever area that we're working for, so if we're doing Ealing, we're going to put the baby in Ealing Hospital.